Thank you very much. My name is Valerie Rowe, and I'm with Catholic Relief Services. Coming from an implementing agency, I think one of the things, it comes from Charlotte's presentation and from Bonnie's, was how do you prioritize the type of intervention? Because there's a lot of things going out there, and we're trying to get the evidence on its impact on the nutrition outcome. But maybe we need to also look at what is the impact on the return on investment. Because as we're talking about the market issue, it might not be so much that they don't have access to it in the market because we don't have a road to get it to the market. And so is the investment on building that road, or is the investment doing the nutrition education, or working with couples to improve inter-household communication so we have better decision making and control of income? So that's kind of the question, because we are around binding constraints. We have funding constraints, we have capacity constraints. And so how can we really look at what are maybe some of the really good short-term, medium-term, and long-term interventions that we can do?
Maybe everybody could be thinking about that. That's a pretty important point, how we prioritize our inevitably rather narrow research programs. Hand up back here, behind, and then Kava.
I was very interested in the results that you had, Bonnie, that you communicated, and one of the points that my group and I were talking about that also kind of relates to some research work that I'm involved with at the moment is the fact that in many programs now we're creating these activities where women are producing vegetables for home consumption. But you know, when they harvest them, okay, they can't eat all of them, so they sell them. They go on to the market. And what happens when everybody is putting their fruits and vegetables on the markets, the price drops immediately. And part of that, it's not just the supply side, it's the demand side. Because who is incentivized at this point? Who do we focus that incentivization on? We focus on the women with children under 5 and children under 2. And they get the message from the nutrition extensionists. The ag extensionists are not communicating it. It's not getting to the full community. It's not getting to the community at large. And and around the world, it's the same issue. We wind up with these communities who do not have access to fruits and vegetables. Why? Because to some extent, there is that drop in demand. There's a lack of demand, which is why I really love that graphic that Dino put up about the fruits and vegetables being equivalent to a World Cup football. Because I think that's where we need to go with this, is not just the value to women and children, but the value to everybody. And it will have also, I think, an impact on overall health, not just the specific health of women and children. Thanks.
Thank you. Very interesting point. Can you come 2 rows forward to Kava? Yeah.
Thank you very much, Kava Joy. We consider 3 issues. One, the issue of breaking down the silos of the different, in the different sectors. So we identify there are not only silos, sectoral silos, but there are intra-sectoral silos, which need to be broken down if we're going to be successful. We also looked at the issue of have a one strategic approach to resilience. The common basket approach in budget support here gives us an example. But if you look at the back of this of the presenters, you see a lot of flags flying. Wouldn't it be nice just to have the logo of the conference rather than everybody flying their flag? That's cooperation for you. It reminds us of what we call the Formula One mentality, where the cars and the drivers all have different logos because everybody wants to fly their flag. The other issue we looked at is that the people who support communities should behave more than like, they should behave like partners more than rather than donors. They should listen to the community, understand the community, work on what the community already knows and build on it, rather than bring new ideas to the community. And the final issue was we think that not much has been said or thought about in this conference about resilience, the urban poor. The urban poor is getting larger and larger, and we're not addressing that.
Great, thanks very much. Let me go way over to that corner, otherwise we wouldn't ever get there. Yes, please, and then a few others. There's a mic behind you.
Yeah, thank you very much. I think the discussion from panel is very stimulating. And I'm thinking that also just mentions that we have to listen to the community. So, and resilience is all about the capacity building. So I'm thinking that sometimes when we talk about capacity building, it's more or less at the household level, individual level. So we try to put agriculture, nutrition, everything to that level. How about we're thinking that capacity building at the community level, to listen to the community demands, what they want, and then the training program, capacity program, can be addressing the household, can address the farmer, the business person. So the program can really address the different aspects, nutrition, agriculture, and business. So it's really enhance the community capacities. I just add one more about the home garden. Sometimes people will sell at the same time to the markets and then reduce the price. So there is a technologies try to solve the problems according to the cropping systems. So different cropping system can help that we can harvest continuous harvest. So when you have a continuous harvest, you can have a household continuous consumption. So that will be good for nutrition. Thank you.
Can we go back to the back corner? And then we've got 10 minutes left, so I really want to get everybody's 5 minutes left.
Okay, I'll just be brief.
So we want to get everybody, so every brief, short comments, but important
Okay,
ones.
brief comment then. I think the conversation around markets is interesting, but it fundamentally challenges for all of us in this room how we function and how we think about our role as a market actor. The big question of facilitation and a systems approach versus direct service delivery and creating dependency.
Great point, yes. Okay, let's try to pick up as many as we can. Up to the row, yes please. Oh, sorry, did you have your hand up behind? Okay, gentleman in the blue shirt and then the row from forward. Yep.
Okay, I've really been impressed with the discussion on markets here, and certainly the importance of markets in rural areas, as was brought out so well, but also in urban areas for the urban poors. So I'm really wondering whether we need to be taking a model from the very old past, the social marketing that was so successful, particularly in population, and then to some extent within health. Do we need to start social marketing some of these vitamin-rich foods? Let's explore this kind of advertising. The one lesson, of course, to be learned from social marketing is that before you do a social marketing campaign, as with any other marketing campaign, you've got to have supply to meet the demand that's being generated. So you can't just have broad public service announcements scattered throughout the year when mangoes are only available for 2 weeks.
Good point. Okay. Could you pass the mic forward to the row in front?
Sure.
Yeah.
He's asking me to speak on his behalf.
Okay.
Actually, in our group, I mean, we are just thinking of the upcoming generation. Mm-hmm. So, in addition to education at the community levels, it has been said right now, okay, what about mainstreaming education in the regular school programs with emphasis at the level of girl teenagers? That can really build long-term perspective. That is what we talked about.
Okay, great, thanks. And right in the back in the middle, and the black white shirt, yep. And then we'll come up to the front.
Okay, thank you. I think this is a very good discussion. Myself, I want to add on what has been said, that we need to go to value chain approach. It's better to go at value chain approach at this stage, because when we look at what is happening today about building resilience and food and nutrition, the value chain approach is the best way to go. And then we, as donors and development partners, everybody, we should think about how we can go to value chain approach and build a lot of capacity in all the segments along our single value chain. Thank you.
Thanks very much. And then in the front row, and there's another hand up behind as well. Okay, yeah. Okay. Yeah, 1 minute left, I'm told. Yes. Yeah, please. Yeah.
Okay, wearing my smallholder farmer hat, very interested in the idea of local markets and being able to increase the range of products that I sell to local markets. One of my big concerns is seed and crop varieties that are going to be responsive to extreme weather, which is coming with climate change. So can we use these local markets as a way also of localizing seed selection and breeding and those kinds of things to ensure that the farmers actually have the plant material they need to continue to supply their food?
Great, thanks. And thank you for that. Hung, I think last comment.
Yes, the last answer that would be very short. Hung from IFPRI, Vietnam and Hanoi School of Public Health. I mean, I like very much the system approach emphasized by Charlotte and also Dino in some sense, because in this room of previous day, when we talk about system approach and the interdisciplinary approach, people were very skeptical. And for that, I'm very happy that you raise more and more the system approach in this workshop. For example, for Dino, the approach about multi-community project. For example, as DJ of the IDVC, you go for that, so it's very positive thing. And I think that's further than system approach, together with the partnership and participation of the community, the so-called One Health and Eco Health at the moment. I think it's very crucial. And my question is for you, you don't respond to me now because we don't have time, but this is a kind of the way forward. So in this kind of intervention for health, resilience and things like this, how much this kind of approach is accepted by donor, or what level we need really to promote and to really have to implement this kind of thing? Because for the community, I think that it makes sense very much because you ask people, how they want. But if you go up to another level, so many people question how realistic this thing can be implemented.